Good afternoon, everyone. I'm Taylor.
I'm Dr. Trahan.
I'm Chanel.
Now what's that?
And then this is our Quality Improvement Project 2020. That's it, right?
Yes.
2020? Okay, so the problem that we're going to address is that the UCLA pediatric dental residents have a limited amount of time to do their new patient encounter notes before the end of the day. So what this, as a result, causes incomplete encounter notes, decreased note detail and accuracy, excessive time spent doing notes later in the day, and then ultimately our encounter notes are not approved by faculty. So I know some of you may be looking at this project. It looks quite familiar from last year. A lot of these results that we just talked about is still prevalent, even though this project was done before. So we wanted to kind of expand on what was done last year and see if we can actually improve the project and make real changes.
Right, so,
Sorry, so there's an overall
oh,
So the overall risk is basically to patient safety. If we don't have accurate notes, it can actually affect the patients. It's not just us.
all right. So just to give you a sense of what's been going on, in the last 6 months, we talked to every first year just to get a sense of how many unapproved notes there are. So unapproved notes are notes that were not finished in time to get swiped by the faculty. So we kind of saw that as, okay, they weren't able to finish it during the appointment time. So the average was 49 notes, with a maximum, no, in 6 months, with a maximum of 66 and a low of 37, and that's not so. When Dr. Silva covers clinic, she gets to approve her notes in her office, so that's like a nice way for us. So that's not in those numbers, so it would be higher maybe if she was not doing that for us.
When did you come to this
After the appointment, no.
At what?
After the appointment.
Like at home or they
No, in clinic. So it needs to be done by the end of clinic day, or else they're not going to get approved. They're unapproved. Those are the ones that come up as unapproved.
So basically the problem is that our patients are arriving with a name and date of birth, and everything else has to be entered into the computer, including a lot of their medical history. So after the first patient encounter, we often use this initial encounter template that we kind of got from either second years or through our email, something like that. And we use that note, we kind of copy and paste for all the subsequent notes. So we usually just copy and paste medical history and sometimes the whole note, and then just make edits to that each time. So if the first note isn't done correctly, it can have an effect on all the other notes. So making sure that that first note is done correctly is really important. And then sometimes patients have extensive medical history, especially here in our Westwood clinic. So we want to make sure that that's done correctly. And then we don't have any standardized visit or encounter templates. I know that the pre-docs actually have one that Dr. Nimi will distribute to them. And we, as a residency, don't really have that. It may be because we all have different things that we want to talk about. But there are certain things that we want to try and standardize, especially for just learning for the board, so that we know what exactly we should be learning and in what order. And then also just making sure that we have everything that we should be asking. And sometimes when we go through the note, it prompts us to think about things that we should ask. So it's good to have a standardized note to make sure we check off all those boxes. Yeah.
Okay. So we did a baseline resident survey just to make sure we're all on the same page and that our problem is a real problem. So the first question, we asked everyone, how long does it take you to usually complete a note for a new patient? Majority of residents said over 5 minutes. Also, majority of residents said that their notes were less than 50% complete by the end of the appointment with that patient. Also, they noted that even though there isn't a direct template that we're all following, that the notes are adequately enough, but some think that they're less accurate. And among all the residents, the quality of the notes, some say that they may not be as consistent among all the residents. So just kind of painting that picture of the problem.
Okay. So in an ideal world, we wish that the note template could be in Axiom itself. Realistically, the cost of doing that is about $10,000 they've estimated. So we tried to find another way to address this problem. And that was the major block from the team that did this before. Okay, so what our goal is for after a month of implementing a new standardized new patient encounter note template, we hope that the UCLA Pediatric Dental residents will be able to increase the overall accuracy and detail of the notes, as well as decrease the time it takes them to complete the note, leading to increased faculty note approval and better patient outcomes. So the way we're going to do this is with our SMART aim, and our SMART aim is that 70% of new patient exam SOAP notes to be completed chairside, utilizing drop-down templates in under 5 minutes.
Alrighty. So then for our root cause analysis, we looked at people, process, history, and methods. For people, sometimes patients come in late, so we have less time to do our appointments during the appointment time. Not enough support staff in the hospital. Sometimes there'll be a scribe, or in a private practice, sometimes the assistant will start the note and then the doctor finishes them off later. And then faculty preferences on when to swipe notes. Some of them like to do it at the end of the day. Some people like to stay afterwards, so it depends. For the process, the Venice location has a lot of other duties, so they have to schedule the patient for their next follow-up. They have to give the patient their excuse note for school, so that also takes time, which is taking away from writing the note during the appointment. And then, like we spoke about earlier, the lack of standardized templates leads to incomplete or inconsistent notes. So the history, the second years last year, they attempted this project, but it still involved a workaround. They ended up doing a forms tab instead of a note tab, and that was something that we wanted to improve on to make sure that the patient notes were to be seen in the notes tab. And then, like we spoke about, the cost, that is just a hurdle to get the Axiom note. So our key drivers, the first thing we thought about was maybe a strict late policy for patients, some type of protocol or grace period. We're not allowed to charge a fee for Medi-Cal patients, so that was out of the things that we could do. Another driver was an automated note or to reduce administrative time. Secondary drivers to that would be computers allowed for dictation or sterile cover so that we could type on the notes with our gloves on. Another driver, which is the one that we are working on, is the use of automated templates to improve workflow. So secondary drivers would be ideally to do Axiom dropdown, but we can't, so we're looking into Microsoft Word dropdown menu. And another primary driver was an assistant or a scribe, so we thought about dental students or dental assistants, or doing our notes on paper and then transferring them. But we thought with the limited scope of this QI project, we would focus on the Microsoft Word drop-down menu and using an automated template to improve workflow as our key driver for our aim.
So we wanted to illustrate in real time kind of what an appointment looks like for an 8:30 appointment. So the appointment is for 8:30, but realistically the patient arrives around 8:35, or they're there at 8:30, but it's a long line for them to check in. patients are told to come about 15 minutes early to fill out new patient paperwork, and the paperwork is mailed to them sometimes, but realistically, it isn't till about maybe 15 minutes later at 8:45 that the paperwork is complete, and now we can bring the patient back and start our appointment. So it's 8:45. Something that we have to do with all new patients is input all of their new patient paperwork into a form in Axiom. That takes a bit of time. Sometimes there's language barriers, and in that Axiom form, there are a lot of fields that are kind of redundant, asking the same questions over. So just kind of going through that, but making sure you've covered everything. Something that was done before was having the form scanned into Axiom, and it did save time, but this way it's still important to put that information in, but I think just to keep in mind that it is eating up a little bit of our appointment time, considering the other factors. So about 8:58, we're starting our note. And from that point, then we gather some of our information, and then we start our comprehensive exam. So that takes we're starting at around 9:03. That takes about 20 minutes to do our exam. We have to go take x-rays, drop the x-rays, diagnose the x-rays. And then so now it's 9:23, and we have our diagnosis, but now we need to discuss with parents and explain to parents, okay, your child has a cavity and what that is, and different treatment options and the protocol here at the school. So, parents are going to have questions, which they should, because this is their child, but it takes a lot of also patient education, parent education, and time to come to a consensus on what you're going to do. So it's 9:28. Now we're trying to figure out, okay, mom, dad, we gave you all of the options. What do you feel comfortable with proceeding? And then at that point, it's 9:28. The appointment is an hour long. So this is 2 minutes prior. Our note still isn't complete. And usually when we see a new patient or have a new patient consult, you're either going to, not all the time, but quite often you go IVGA route or conscious sedation or an OR workup, which requires even more additional information that you need to gather. So just to illustrate, 58 minutes and our note still isn't complete.
Question, when you do the exam and the x-rays and all that, are you doing the x-rays or the assistant?
We're doing the x-rays. So yeah, we get the stuff, get our film, our lead aprons, capture the x-rays, drop the x-rays, and then other residents are also doing the same thing as well. So we're waiting in line to do this, and then, so I think 20 minutes is fair, right, for a comprehensive exam? You guys agree? Crowd participation? Yes? Okay. All right.
All right. So before we implemented our plan for the PDSAs, we had several tasks before we could jump into our tests. So we were reflecting on what the second years did last year and what went well for them and what we thought we could improve on. So they did a forms note, which there was a consensus that it wasn't favored because they wanted it to be in the patient note. So we were like, okay, we need to have something in the patient notes. So we talked to Cheryl, and the way that we could do it with her for free was it would just be the prompt, and then you would have to fill in the blank. So that didn't cut any time, because then we couldn't copy paste the long template into that, because we would have to like copy half of it and then paste it. So that was just going to be longer. So we decided not to do that one. And then so then we defaulted to using Microsoft Word and developing a drop-down menu that we can tab through and then copy paste that as a whole and enter it. And then Trahan is going to give you guys a demo on how that's going to work. So we ran these tasks, and then we decided that we were going to do the Microsoft drop-down menu. For tests, we wanted to test the dope note, which we'll get into it, to see if we could test real time, but we couldn't really test it real time if it was less than 5 minutes, because you started and then you're doing something else and you're doing something else, so we weren't getting an accurate timing. So we decided we were going to do some subjective measures on that. And then what we did use was last year they did a standardized note. They had a case, which they all did it and they all timed themselves. So we're going to give you guys objective measures on the timing and then subjective measures on the attitude and how we thought it went through.
So the plan is to add a drop-down note that will utilize existing technology and minimize the amount of time needed to complete it and to improve the accuracy, just because when you run out of time and things get pushed off throughout the day, sometimes what ends up happening is you might forget little details that also happened during the appointment. And then after, we're going to survey the residents to see the likability and the ease of the use, the time that it took to do the notes, and see how it worked out.
Okay, so our solution we thought really needs to have zero cost.
Thank you.
It needs to be able to work on the dental school computers as it is. We need to be able to cut and paste into Axiom, which is actually a barrier if we're doing a remote desktop, which we'll talk about. It needs to be easy to learn, easy to implement, because a lot of us already have systems in place on how we kind of get around this. So in order to learn something new and to do a new process, especially for those who are graduating soon and have been doing this for a year and almost 2 years, trying to learn something new and they've already figured out how to work around this, I wouldn't expect them to adopt it as easily. And then, but it does need to save time for the residents, and we'd like it to be standardized so that everybody has the same note, and then when new residents come in, they can understand what we need to ask, and also they have a good checklist in their mind of what needs to be done during each exam. So what we came up with, and naming it was part of it because we wanted it to be catchy, is something called the DOPE note. So the DOPE stands for Dental Operatory Patient Encounter, which we just thought kind of rhymes with soap note, and I've been hanging around Sean too much. He says dope a lot. So so that's kind of where that came from. So here's a little tutorial. I'm just going to exit out of this and get into the desktop, I think. Hopefully. Exit. Here we go.
Oh, that's what I thought they were using that. And so where does it come from?
It comes from me. All right, so this is basically the dope note. The first thing that
So you were in Axiom and then you just open a Word document?
this is just a standard Word document. Let me see if I can.
Yeah, it's in Axiom. It has its own little icon. It says dope note, and you just click it.
It's on. No. I'm sorry.
On the desktop. On Axiom.
Menina.
Yeah.
Desktop.
We can't do anything in Axiom that's $10,000. So, so essentially, it starts out like this, and then the first thing I had to do with each computer in the clinic was, and this computer is enable this developer app, and then you have to protect the form, so that way you can access the drop downs. And I think I've just unprotected it. Yeah. So anyway, once you protect the form, you can go through and choose the drop downs. So I have a female. She's here with mom, dad, parents, grandmother, guardian. They're here for an exam or consultation. So the other thing we decided to do was really focus in on new exams for patients age 5 and up. And then if we find that this works or we want to expand it, we can always come up with different templates. But for right now, we're just sticking with this demographic.
Why 5 and up? What would be the difference?
Because if they're infant or they're younger, we just have a few different questions we ask. Mainly, well, Canberra's a different tab, but we don't ask about ortho as much. Like that, some of that stuff is, you can, so you can just not copy and paste it. I just find that 5 and up is a little different than 4 and under. I mean, the infant one is very similar, but there's a few little differences. We don't have as many X-ray options and things like that. It's actually not made yet, so I don't exactly know how it would be different. But it's slightly different. It's a little bit less to fill out. Again, trying to save you a little bit of time. But then there's also different things. So basically, you can just go through here. There are some common conditions that you can choose. And then allergy. So these are common ones. So we'll talk about the limitations to this. You can't.
Can we add if you don't have in the list? Can we add? Does it allow us to add?
I can't. I mean, we can add.
Blank space so that we can add.
Exactly. So what we would have to do, and we'll talk about this in limitations, is just copy this, bring it over to Axiom, and then add. Again, this is a workaround. It's not ideal. This is kind of what we figured we can do to save the school $10,000.
But this is kind of what you would want Axiom to look
Exactly.
like.
This is what we would want Axiom to look like. So then, I mean, we all know these things. These options, we're very familiar with them. Here's habits. Sometimes I forget to ask this, and it's obvious. You can do 6s, or the 7s are erupted, 8s are visible on the last pano. Whatever you want to do, early mixed. So we tried to include everything. Obviously, if this were something that we want to implement, we would get the faculty's input on it, but this is just what we figured we'd like to use. Again, not just the Frankel score, but a little bit of a comment, and you can always make your own comments later. Do we do fluoride varnish or foam? Things like that. So this is done in Word. The problem was when I went to put it on all the computers, I had to put directions at the top on how to protect the form, because you can't copy it. Now if I go and try and copy all of this, it doesn't let me do anything. So I have to unprotect the form and then go in, and now I can copy it. And then right click.
Then if you unprotect, is it gonna save? Can they save? Or it doesn't matter if they save, you can still make changes?
Yeah, that's we don't really want everybody to save it from this, because yeah, exactly. So we have issues with that.
Then we can open the drop down anymore?
You can. It's more the free boxes that if you type something and then you save it like that, then the next person has come through. And one of the biggest things with the templates that we have right now that we get through mail is that we have to delete a bunch of lines where people have put blank. So it's like, but you'll see a lot of charts with this, none, because they didn't erase it, because it takes time. So some people just leave them, and that's fine. But we're trying to avoid that. So like if you go up here and you put in, she's 8 years and 2 months, it gets rid of the extra automatically. So that's basically the dope note.
Okay, I'll pay $10.
Okay.
Add some zeros. That's some zeros.
Okay, let me get presenter back up here. We're out of time. Okay. So here's our due process.
All right, great. So we have a couple processes. This is route 1. This is what we do right now. We have it in mail, so we have to make sure the mail is there. We have to copy paste that into the note. We have to edit that and then review and edit. This would be implementing the dope note, so we have to open Word, use the drop-down menu, copy paste it into Axiom, review and edit. The ideal one would be to have the dope note in Axiom so that we don't have to do the whole copy paste, which takes some time. So what we did to some of our dues was we wanted to get some objective measures. So we did a sample case that they did last year. They did 2 sample cases last year. They did a 2-year-old and a 6-year-old. We took out the 2-year-old because we're doing 5 years and up. So we did this case that you can see on the board. I'm not going to go over it. But we each of us did it, and we timed ourselves to see how long it took us doing it with the dope note and how long it took us doing it with the regular copy-paste method that we have. So one of the limitations is that we're comparing our data to last year's data, and that was 4 different residents, so it's not necessarily cohesive. It looks like they were a little bit faster if you see right here. So this was last year, their general note, they did it a little bit faster, and they did the smart note. And they did that pretty quickly as well. Our dope note and our general note, I guess we're a little bit slower than they were in typing. But there is still a difference between the dope note.
The Smart Note is in the Forms tab, and it doesn't end up in the patient record.
Yeah.
Progress note.
This is what they did last year, so we were trying to improve and take it one step further. But you can still see that we actually have a 1.8 faster time doing the dope note versus the general note. It is still a little bit slower than the smart note, but we're going to go with that because it's going to be in the notes instead of in the patient forms. And yeah.
Okay. So we did another survey after some of the residents were able to try out the dope note, and we found that it takes them about, majority of the residents, 3 to 5 minutes to complete the dope note for a new patient, which is quicker than our baseline. More than 50% of the note is complete by using the dope note. And the quality of the note is consistent among all the residents from majority of the times using the dope note. So that was a big thing: the accuracy, the quality of the note, and the speed.
Okay, so some feedback that I got, some residents were concerned about HIPAA. There's no patient information or patient name on the dope note, so if you do save it to Word, you don't have a name going with that chart.
No name and no chart number, right?
Exactly.
One of the feedbacks was the universal reflex, and that's what Dr. Silva was talking about. What if you accidentally save it, which I did, and then it was kind of a hassle to go back and fix it, and I didn't know how to fix it. So we definitely have to do some training with all of the residents and the staff to learn how to do it.
It might be awesome to get IT involved because
You'll also be able to control that by protecting it.
Yeah, well,
You know,
if you
like
protect it, you can't copy it over.
No, but you can.
So I don't know.
What you can do, like where I know you can do this with PDF, like you
Yeah.
can restrict if somebody can print it.
Yeah.
Things like that.
Yeah.
I don't know. I've never done it with Save, but.
So
And I think what also would work, I know that a lot of our departments at UCLA use the fillable PDF forms. I know
yeah.
if you use the Adobe Suite, which is about $300 if you get the full version.
Mhm.
That way you can create all these
Yeah.
drop downs. There's places you can type versus drop down.
But then,
Yeah.
copy and paste from Adobe is different.
It does
doesn't
copy
allow
and
you to
paste,
copy and paste like
Yeah.
you do for Word document.
but it does work because we use it with OCGA. So you might want to check into the fillable
Yeah.
PDF forms.
I
They're
think-
not free.
Kind of my original
software.
statement of let's get IT involved because they probably know these things. And then time to train the residents. So I would love to take everybody who's already doing something and then training them how to do it. But I'm also doing notes and seeing patients. So it kind of goes back to what's our availability during the day. Do I get blocked off for a day to train people? Who knows? And then we still need to copy and paste. There's still issues with a remote desktop. We can't do this in the Venice clinic because you can't copy something from any remote desktop and put it into a different desktop because you're essentially on 2 different computers. And so we wouldn't be able to do this on our laptops, which is where some of us end up writing our notes. But hopefully that's what this whole project is to help fix, that they get done faster so we don't have to do it on our laptops later on while we're watching TV. Or whatever. I don't do that. So basically, challenges were just having the residents learn the unique workarounds and kind of following the directions of now you need to click developer, and then now you need to click lock, and then now please don't save. All of those things were kind of issues. We weren't able to really objectively measure the outcomes too much because we have so much variability between residents and how they do things. And then just it's more difficult to implement something that is new. And then the ability to cut and paste from Axiom on our personal laptops. So what we kind of see for the future, in the very near future, we can definitely get an infant oral exam dope note. We can do a dope note for anything, but I just feel like that's kind of the natural next step. In the near future, we'd love to have the first-year residents coming in adopting this from day one so that they don't figure out other workarounds that are less accurate, but this is how they learn, kind of like we just learned from day one, is take it from the mail messages in Axiom. And that was just if you learn that from day one, it's really not an issue. And in the very distant future, we'll get Axiom drop-down notes.
So who told you that it cost $10,000?
It's unofficially.
An anonymous source downstairs.
No, but I need to know the real cost.
That's what we asked them when Keith had the real cost.
Yeah.
And they wouldn't give us.
They didn't want to be responsible for.
And I was told to keep it anonymous. And last year they were told that it was like $250 per hour, and who knows how many hours it takes to develop. Or that's what I heard when I was presentations. So it's not cheap.
I think though the work that you've done is going to be a huge help in getting that kind of estimate, because you have all the code available, that work done, and it's it'll be easier for somebody to scope out the job. You know, so for that.
Cool. This was kind of this is really just an overview because we just had time to do one PDSA cycle with all the different surveys and timing. We had to time everybody based on what they were doing and then time everybody on the dope note, and it was just ages 5+. Half of them, 47%, don't show up. So we just had to take the data that we could get. But basically the plan was to add a drop-down note that will utilize existing technology, minimize the amount of time needed to complete the notes and improve accuracy, and then survey the residents. We want them to like it, first of all, and then we want it to be easy, and then we need to time them, old versus new. And then we took also the 4 residents, S, and we completed the dope note based off of the dummy patient that was done last year with the smart note. And then we also timed as many residents as possible, whoever had patient exams, basically in the past month or so, with the dope note to see how long it took them. And then took the data, we found it was 1.8 times faster to use the dope note. The objective resident survey just said that the feedback was positive, people liked it, but that it was difficult to use. There's a longer learning curve to implement it, and there's some technical difficulties sometimes. So basically to go in the future is just to adjust the dope note per the resident feedback, offer training on the use, implement remote access using IT professionals, and I think just getting IT involved a little bit because my knowledge is only limited on Word, and hopefully IT knows a bit more. So basically it worked. We had to find basically some quirky workarounds. It's not ideal, but it's a new process for residents to learn, and it's not an ideal situation, but we're trying to figure it out. That's it.
Well done.